Hi everybody, welcome to POC Nurse. My name is Gozi. In this video, I want to talk about how I got my first nursing job. So I know sometimes when people finish nursing school, they get jobs right away. It takes some other people a little longer to find work. Well, in my case, it took me about a year, but there were other circumstances that came into play. So I finished nursing school September of the year that I graduated. And I found out that I was pregnant that same month. So I really didn't think much of the pregnancy. I thought, I'd still go ahead and look for work and do all the things I was supposed to do as someone that just finished nursing school. So I am the kind of person that has to prepare, like super duper prepare before I write an exam. So some of my classmates wrote the NCLEX right away and they passed. I was amazed. I was really impressed with those students, but I knew I don't function that way. I couldn't do that. So I took my time to study. I studied for a few months. So I finished in September. I know I took the NCLEX after Christmas. So I took it the following year, sometime during the fall or the winter, because I had my jacket and everything off. And when I got to the exam center, I had to take everything off. So I took the NCLEX the following year and I passed. So I was thinking, I'd start looking for work. And remember, I was still kind of new in the country. So one day I went out with a friend. I think we went out shopping or something. She hadn't seen me in a few months. So when she saw me, she saw I was pregnant. We both went to nursing school together. And she's from here. She's American. And she told me when she saw my belly, my pregnant belly, she said, no one's going to hire you. You're pregnant. So you're probably going to start looking for work after you have the baby. And, that stuck in my mind. And I took it as, the truth, as in, if you're pregnant, no one's going to hire you. Maybe that's the case, in the larger society. But, and I want to say this here in case someone out there is pregnant and they just finished nursing school. You can get hired even while you're pregnant as a nurse. I've seen it happen over my career. I've been a nurse over 10 years. I've seen my managers hire pregnant nurses. I've had my friends go from the job we were at to another job while they were heavily pregnant. I had one friend that was going to be doing literally 2 months that got a job. And then she stayed on the job a few weeks, had her baby, and then went back to work. So I don't want you to make the same mistake I did. If you are pregnant, you can absolutely get hired at a job and go ahead, take your time off, have your baby, spend time with your baby, and then go back to work. It might not be easy, but it is possible. Back to my story. So because my friend told me this, I was like, okay, I'll wait. After I have the baby, I'll start looking for work. And that's exactly what I did. I waited. I had my baby June of the following year. So now it's been like 10 months since I graduated nursing school. And then I started applying for work. I went and I think someone had told me to go drop off a physical application at one hospital. I did that. I filled out applications online. No one ever called me back. And I don't think anyone even ever acknowledged my applications. But it was my first time looking for work as a nurse, so I didn't really know what to expect. So I did this for a couple months. I kept applying. I wasn't getting any response. You have to remember, I had zero experience as a nurse on my resume. I didn't have any experience at all. I hadn't even worked as a CNA, so I couldn't even claim that on my resume. So I sat down and I started thinking to myself, okay, what can I do to make myself more appealing to employers? So I remembered while we were in nursing school, there was talk about this nurse residency program that you had to pay for. So, but when people would bring it up, they would, like my fellow students, they would say, well, you're not supposed to pay for a nurse residency program. it's supposed to be free. They train you and sometimes they hire you, which was true. Some nurse residency programs are free. This one was not. So what I did was I reached out to some of the students in my class to ask about, do you know anyone that did this nurse residency program? Did you do this nurse residency program? How did it work out for you? So what I found out was that most, if not all, of the people that did the nurse residency program were working. Either they were working at the facilities where they did the program or they got hired somewhere else. And it wasn't cheap, these programs, but, I was home. I wanted to start working, and I was willing to make the investment into this nurse residency program if it would help me find a job. So I called up the program, or I called my school. I don't know which one, but I got information on the program. The cost had increased after a year, but I was okay with it. I paid for the program, and you could pay for the program instrumentally, so that worked for me. So I registered and everything. We went to the hospital where we were going to train, and they interviewed us about where we wanted to be. And there was this labor and delivery nurse that really made an impact on me. She was the nurse that delivered my baby that I had in this country. She was so kind to me, and I never forgot her name. It's been many years. I never forgot her name. So I was thinking maybe because of her, then I wanted to be a labor and delivery nurse, because I also wanted to take care of people the way that she took care of me. Because it was so scary having a baby here. You get attached to all these machines. They put oxygen on you. It was bewildering, to say the least. But she was very calming, very gentle, very kind to me. So when they were asking us about, what kind of nursing do you want to practice, or what department would you like to work in? We'd been told throughout nursing school, you have to start in med-surg first, med-surg. But I also had this L&D thing in the back of my mind. So I told the lady that was asking us, L&D or med-surg? So when I said L&D, I was still expecting to get put in med-surg. And when she came back, everyone else was in med-surg except me. So I was like, I'm not sure if this is going to work. Like, am I going to find a job after, doing L&D? Would it be better for me to do med-surg first and then go to L&D later? And she was like, no, it's okay. There's high demand for L&D nurses. You'd be fine. To be honest, I wasn't so sure. I wasn't sure at all, because why is everyone else in med-surg and I'm in L&D? Like, why am I different? But, she was right. I went to L&D, did the nurse residency program there. However, knowing what I know now, I wasn't really fully well trained in L&D by my preceptor. I don't know if she didn't take the training that seriously, or maybe she thought I was going to get hired there and get like a real proper orientation. But she taught me how to document on the strip. She taught me how to document on the baby's heart rate, what to look for. She taught me how to document on mom's contraction pattern. She didn't really go deep into medications. She didn't go deep into, like when you get your sick moms. This hospital was a level 2 trauma center. So they did high-risk pregnancies there. They delivered premature babies there. They took care of moms with all kinds of, diseases associated with pregnancy, or even not associated with pregnancy. We had a cystic fibrosis pregnant patient one time. They did try to transfer that patient out, but she refused. But just to tell you how sick the patients there could be. So my preceptor didn't really go into all of that. She really just gave me the basics. But I think it was okay for me at that point. So that's what I learned during that time. I also learned, because remember, this is my first time in the workforce in the United States. I try to be myself. I'm usually quiet. I try to be myself the whole time. People were kind to me. I reciprocated. And then towards the end of my nurse residency program, you know, I asked my preceptor to speak to the manager on my behalf. I spoke to the manager. She told me she didn't have room. She wasn't hiring. I was like, okay, I thanked her very much. And then one of the senior nurses there, she came to me and she said, I have another job somewhere else. They need L&D nurses there. They are hiring. Would you like for me to put you in touch with the manager? The power of networks, the power of networking. You might be quiet, but you can still network. I was very quiet. I'm still quiet, but not as quiet as I used to be. So people observe you also. People observe how you work with others. They observe your work ethic, and their observations might push them into offering you opportunities that they know about because they feel like you will fit in. They feel like you will do well over there. They feel like it will benefit you, benefit the company, things of that nature. You have to be aware of how you are in a place, and you don't really need to worry about how people perceive you, but I think it's important for you to be your authentic self and work well with others while being yourself. If you're a kind person, hardworking person, ethical person, you should have no problems. But anyway, so I was basically just quiet. I did my work. I was very I didn't make any waves for the most part. That changed though after I had some time as a nurse. As I grew as a nurse, you get bullied sometimes. If you're quiet, people feel like they can bully you, and in instances like that, you have to stand up for yourself. So I had moments here and there where I had to speak up for myself just so that someone would get off of my back and leave me alone, and things like that. Anyway, so she put me in touch with this manager. I applied there, interviewed with the manager, and she gave me a chance. I got a job as a labor and delivery nurse, night shift. I got trained at that job. I got the standard amount of training, I think 3 months. And I think my nurse residency program lasted about the same time, 3 months. So I got 3 months in the nurse residency program, and I got 3 months at the job that I got. So I was at that job for 3 years or so, and I took a per diem job during that time. But while I was at that job, a spot opened up at the hospital where I did my nurse residency program, and I got my third nursing job there. So I was at my first job for 3 years. I was very grateful for that job, very grateful for the nurse that put me in touch with that manager. I learned a lot at that job. It was a much smaller hospital, so we had to improvise with a lot of things. We, the nurses, had to be a lot of things, so I learned a whole lot. Now, when I went back to the hospital where I did the nurse residency program, they had more resources. So because I'd been so dependent on myself for many things, my knowledge base was bigger than it would have been if I had stayed at that hospital where I did my nurse residency program. So by the time I went back there, I was very knowledgeable, able to stand on my own, able to care for my patients, without anyone having to look over me or anything. So the only thing was I was now doing those high-risk patients and learning more about how to care for those patients and the disease conditions that go with those patients. So it was good. So essentially, I got my first job through networking, if you want to call it that. That's how my sister put it to me. She said, that nurse was part of your network. That is how you kind of were able to move from that residency program to that job by leveraging the power of your network. So that's the story of how I got my first job. I know these days I see a lot of nurses that are getting jobs right out of college. The place where I'm working at now, I think they went to some nursing schools and talked to the graduating classes and invited some of the students to interview. So we are doing a lot of orienting at my job right now of fresh grads out of nursing school, and this is in the ICU. So all the old things that people used to say about starting med-surg, you're never going to get hired in L&D or ICU as a brand new nurse, those don't really apply anymore. I've been in L&D and we've hired brand new nurses right out of college. I've been in the ICU. I'm in the ICU currently, and we're training a lot of new grad nurses. So whatever your dream of nursing is, wherever you want to work, go for it, apply. You might get in. If not, just get in somewhere and then you can move wherever you want to be. But yeah, that's the story of how I got my first job by networking or leveraging my network at the time. And thank you for listening to this video, and I will see you in the next one. Bye bye now.